but maybe we can skip to how using an external hiring team provide a strong leadership pipeline and kind of improve that long-term workforce stability piece, and maybe talk through how you're partnering with an RPO vendor to achieve those successes.
Sure. Yes, for us, an RPO has been wildly successful. So I will tell you that, let's see, I've been here about 7 years. I came as an interim through B.E. Smith, and I never left after 3 months. And so a short time after I was here, our one and only recruiter left, and I always say ... and then there were none. And so we had to hurry up and figure out, what are we going to do? Just so happens that where we were at in our development evolution as an HR department was we were definitely more tactical and less strategic. And so to replace that function was, in the short run, very easy. We took an administrative assistant and sort of backfilled her and repurposed her to be able to do what I call the electronic paper pushing, because we were really a post and pray shop. And so then we had to say, okay, now what do we do? Do we do what we've always done and expect a different outcome, which is the definition of insanity, or do we really look at a different model? And we looked at a different model, and that was the recruitment process outsourcing model, RPO. We partnered with a vendor, and what I would say is that it's been wildly successful. Currently, we have under about 60, we just met, as we meet weekly with our partner, yesterday we had 65 openings in the entire organization, and probably less than 25 or so of those are actually in nursing, and the rest are, a smattering throughout the organization. But, what I think some of the things that contribute to that success are, when you have a recruiter, and if you walk up and down our suite here, you would not find a recruiter, because they are all, first of all, employed by the third-party RPO, and secondly, they are remote. And so they are able to really focus entirely on recruitment. So they spend their days just looking at recruitment, and they don't get pulled into the day-to-day meetings that sometimes happen in HR departments. So I think that's been one of the the things that have helped us. The other thing is that we didn't, coming from where we started, we don't have a lot of sourcing capabilities. We have no sourcing capability, or had no sourcing capabilities. And so, the ability to have that partnering with, a third party who has much more robust ability to do sourcing of candidates has been huge, because, we were a post and pray shop, and now we're really going after those passive candidates using LinkedIn and other, tools. We've been able to also sort of assimilate the recruiters into our culture, because they act like, sound like our own employees. They have, a Washington Health email. They answer the phone, Washington Health. So I think we've been able to use that third party to really assimilate them into the department. And also, we were able to, as a result of, going with a third party, we were actually able to increase our headcount by 1 and not increase our output of dollars, because we didn't have to spend money on LinkedIn seats, and because that's a part of our contract with our third party. So, that's why I say it's been the perfect answer for us. It's not the perfect answer probably for everyone, but given the size that we are, and some of our challenges, it's just been the best thing since sliced bread, I guess. And or some of the other things. I mean, we've been able to bring down time to fill. Our time to fill is right now 40 days is our average time to fill, which is a great, I think, metric. So I think, for us, like I said, the RPO has been a great solution. And, I always call ourselves a tweener organization because we're not a large health system. We're a standalone, single hospital system. Don't have all of the resources that large systems do. We don't have centers of excellence. We are who we are. And so, again, I just can't say enough about, an RPO for at least for our needs here. I think the other part of partnering with, a third party is just having them be, that you talked about earlier, kind of that thought partner, and being able to talk through issues. We do have also, we've used interim leadership, as a excellent way to sort of be stopgap. Because of the size of our organization, we're not, we don't have a lot of depth and bench strength. So being able to bring in an interim leader, has worked out very well for us. I mean, we've had many, interim leaders from B.E. Smith that have allowed us to spend the time and find the right person for the job, as opposed to just, who's the warm body that's going to come in and fill the position. Having that interim leader in place allows you that time to be able to really assess. We did it in our own department. We took 6 months before we ended up, pivoting to RPO, but we were not using interim work, but, we were able to take that time. And I think when you have an interim leader in place, that also allows you to take that time and find the right fit. So, as I think about, the third party, those are some of the highlights that come to mind. So I don't know if
I think that
back on.
Yeah, I think that's great, John, too. And I to your point earlier, you started as interim, right? And so finding someone great like yourself from B.E. Smith that then transition into maybe long term after they've tried it, you've had an opportunity to assess and go from there. So I think that's
we both tried each other out. I guess we liked each other because I'm still here 7 years later.
There you go.